Oral health is essential to overall health. Unfortunately, critical illness and its treatment can cause oral health to decline. Those at an especially high risk are patients who require breathing assistance in intensive care units. Providing oral care to these patients is typically complex for clinicians and painful for patients. While this situation has long remained an underexplored facet of ICU patient care, one research team has now identified strategies that could greatly improve patient health and quality of life. Among the most important, reducing procedural pain and boosting supportive communication with patients to facilitate oral care. To begin, the researchers captured photos and video of 3 orally intubated and mechanically ventilated patients. These patients were both difficult to treat because tubes crowded the oral cavity and showed adversive behavior during oral care. The team then interviewed ICU and non-ICU clinicians to collect multiple perspectives on treatment approaches. The visual data proved enlightening to both groups, with procedural pain revealed as one of the most important preventable precursors to difficult oral care. Participants could clearly perceive patients grimacing, turning their head from side to side, and even biting to indicate their distress. Interviewees identified communication with patients as one way to improve oral care, from verbally walking patients through each treatment step to non-verbally cueing them with light touch and gauging their response. Clinicians also cited drug-related strategies such as moisturizing dry, inflamed tissue as essential to reducing pain and thereby improving oral care. Non-drug strategies like the use of mouth props were noted as well. In comparing the two groups of interviewees, the authors of the study observed a clear disconnect in how ICU and non-ICU clinicians approach preventative oral care. While those in the ICU emphasized pneumonia caused by ventilation equipment as a primary risk, those outside of the ICU focused on dry mouth and dental decay. This discrepancy highlights the opportunity for integrating oral health competencies among the many different healthcare professionals who treat patients in the ICU. What all interviewees could agree on was the power of the visual data they were presented. In addition to a method of learning about the technical delivery of oral care, imagery captured the human dimension of treatment procedures during critical illness. Further research capturing a wider variety of patients is still needed, but the findings are encouraging as they highlight several ways of improving oral care for critically ill patients and the untapped potential of photos and video in educating clinicians.